Yep. I don't think it's supposed to do that, but there we go. Are we good? Are we live? Is it happening?
You're live on something. You're live on something for sure. TikTok, you're not like that. He's asked me to choose a subject.
Oh, okay.
We're
Choose a
gonna say
subject.
education.
Education. That sounds good.
This is an education segment.
Are we live?
Yeah.
We are live.
You're live.
Hi, everyone. Welcome to Fertility Factor Fiction. I am your host, Dr. Rahi Victory, a reproductive endocrinology and infertility specialist and OBGYN. And I am excited to share with you tonight a super cool article that finally came out because there have not been a lot of super cool articles lately. And this one is focused on the relationship between diet and miscarriage. And Tarek is currently fiddling with our phone. I have no idea what's happening over there. So thank you for joining us. I hope you guys have had a good week. Little quick note, there will not be a Fertility Factor Fiction next week because I will be in Berlin, where I forgot to mention to you, I rented an Audi R8 to drive on the Autobahn.
I think I'm allowed to be upset.
I know. You probably, I figure you might be a bit upset.
Yeah. It
So
sounds unfair.
as you all know, I'm a bit of a car fanatic. I am totally stoked to be driving a fast car on the Autobahn, so that'll be exciting. And I hope otherwise you guys have all had a great week and that everything is going well. We had some interesting posts on our most recent Instagram and TikTok, where I asked people what they would tell themselves if they had gone back. And so that was great. Lots of great input from all of you. So thank you for commenting. And then we had a really interesting response to tonight's topic, which was that one of the people that saw it was worried that this would make women blame themselves. So I wanted to spend a minute and just say, this is not about blame whatsoever. This is about trying to improve your chances by making good choices. And that's equally as true for the guys as it is for the women. I spend at least 5 to 10% of every day telling guys that they need to stop smoking, drinking, and using drugs. This is really no different. It's just making food choices that are different. So we're not judging anyone. We're not telling you to blame yourself for what's gone on in the past. We're just telling you about what you can do to improve your outcomes so that we reduce the chances of miscarriage and go from there. And actually, it was kind of particularly interesting that people were just assuming that there was a particular diet pattern that was good or bad, because I didn't even present any data, but people were already upset about not knowing things. So I'm not quite sure how to respond to that, but hopefully you'll watch and understand that this is totally judgment-free. We are all about helping you. That's all Tarek and I have done for 4 years now, so we will continue to do so. And I admittedly was a little bit shocked, but I'm not going to back down from helping people because it might need them to make difficult choices. So, that's, like I said, every day. I had to tell 2 people today that they needed to cut back or quit drinking. That's just everyday common knowledge stuff where we have to, tell people they need to make lifestyle choices. So that's part of fertility. I mean, there's no question that lifestyle has an impact. And so in this regard, this is really interesting. And special thanks to one of our viewers who mentioned a particularly interesting study that had come out in 2018, where they prospectively studied some people. It's called the Earth Study, and they were looking at environment and reproductive factors. So it was kind of an interesting study. It didn't really have a lot that was new, other than some components of exercise where too much was not necessarily a good thing. And a little bit was a good thing. So thank you for sharing that with me. And for any of those of you who have interesting articles you want me to take a look at, I'm always excited to look at articles people send because that's what makes us grow and get better. And I actually learned about last week's episode, which was the alpha lipoic acid, from one of our viewers who said, what do you think about alpha lipoic acid? And we decided to take a look at that and see what it was all about. And sure enough, we're now giving it to everybody. So if you have interesting stuff you want to share with us, don't hesitate, let us know. And I won't see all of you. So for those of you who are part of the Muslim community, happy Eid. It's on Friday. Friday, right? Yeah, I got it right. It's on Friday. And for those of you that are fasting, like my dear friend Tarek, congratulations on almost being done. 2 more days, dude. You're going to make it?
Very excited.
Yeah. And the poor guy is starving through this so that we can eat together afterwards. But I am starving with you because I didn't eat.
Brothers in starvation.
Brothers in starvation. Okay, so we can share. I think I'm sharing already, right? Whoops. Yep. So the article is called "The Association Between Dietary Patterns and Risk of Miscarriage, a Systematic Review and Meta-Analysis." Now, I will tell you, this is an exceptionally detailed study. They spent hours and hours and hours and hours going through every single bit that they could. And I don't have enough time tonight to go through every single bit of it with you, but I will go through the highlights. And the highlights are kind of interesting. So hopefully you'll get some good sense of what's appropriate, what's not appropriate. And I have to say, I frequently talk to patients about the relationship between their diet and their fertility chances. And we know that things like the Mediterranean diet is supposed to be better. The kind of Nordic diet is supposed to be better. The Dutch diet, that kind of thing. So there are some diets that have been shown to be beneficial, but I actually haven't seen one kind of grouped together meta-analysis like this on the relationship between diet and miscarriage. Now, we get asked all the time, what should I do to prevent a miscarriage? And what should I eat and stuff like that? And I generally was telling people just eat healthy, a normal balanced diet, rich in fruits and vegetables, and try and minimize your exposures to high sugars, high cholesterol, red meat, that kind of thing. But that was just like common sense. There wasn't data behind it, but this is actually data to support certain approaches. So these studies, so actually not a lot of studies on this topic. 11 were cohort where they followed a group, 9 were case control where they compared people, the outcome, and then looked at their dietary habits. And then they said 6 were suitable for meta-analysis, 2 cohort, and 4 case control. So they really whittled it down from 20 studies to just 6. So automatically you lose 14 studies worth of data. Excuse me. Nevertheless, this still included 13,183 women, which is a lot of people. And that provides us with really robust data. And you can get reasonable conclusions when you have those kinds of numbers because the statistical significance automatically gets much, much higher than normal. So what did they find? Well, it's all here, but I'm going to go through it with you in chart form so that we can go through it and explain it all to you. So bear with me while I scroll through 15,000 pages here as we get to the end. And this is a pre-proof article, so it hasn't been published yet, but it will be coming soon. Okay, we're still sharing? Okay, so this was for the cohort studies initially. And what they showed here was that in these cohort studies, if you took fruit, and I know you can't probably see all of these well, but the first one is fruit. You had a very significant reduction in miscarriage. You were down to just 39% of those that did not have a high fruit diet. So a significant reduction, a 61% reduction in miscarriage rate if you had a high fruit diet or a diet high in fruit. For the people that were taking lots of vegetables, very similar. They had a very significant, a very significant decrease in risk, 41% in this group. Again, very significant, obviously makes a big difference, and you are achieving a much lower miscarriage risk if you have a diet that is rich in vegetables. When they combined fruits and vegetables, again, a 37% risk in a diet that was rich in fruits and vegetables, again, highly significant. So everywhere where you see that red diamond and it's not touching or crossing that middle bar, it means it was highly significant. So that's very, very beneficial. Meat, they actually didn't show. Now, they suggested that there are some studies that look at meat and show that it increases your chances of gestational diabetes, your chances of preeclampsia during your pregnancy if you have a diet that is too rich in red meat. But they did not show a definitive change in miscarriage risk. So if you feel like steak, you can have a steak. Is it good for you? No, because it causes colon cancer. And like they said, there's higher cholesterol issues. There are risks of preeclampsia, diabetes, but it's not going to increase your risk of miscarriage. So if you're worried about it from a miscarriage perspective, don't be worried. It's safe to take. And the same thing for red meat versus all meat. White meat, which included chicken and fish, it was right on the border of significance. So it touches one, but it's close enough that there likely is a benefit to taking white meat. So if you're having something like chicken, it might reduce your chances. In this study, they were suggesting by 20%, but it's not statistically significant technically. Seafood definitely decreased your risk, 19% reduction, and that was significant. So if you have a diet rich in seafood, then it's going to benefit you. So this kind of flows back to the Mediterranean diet, which is lots of grains, lots of seafood, lots of fruits and vegetables. So that diet does look like it's not just beneficial for getting pregnant, it's actually beneficial for also staying pregnant. And this is data, like I said, we have not seen before. Dairy products, for those of you that are worried about hormones and exposures and stuff like that, it's actually quite a significant reduction in risk if you are taking dairy products. So 37% reduction in your risk of a miscarriage if you have a diet rich in dairy products. And there were multiple studies involved in that, almost all of which showed a benefit. There was just one that did not, and that was done in Algeria. So, and that was the smallest of the studies. Eggs, also significant, and I never would have imagined that eggs would have a significant role, but if you've got a diet that's rich in eggs, 19% reduction. So the big question here is, what do vegans do, because they're not having dairy or eggs or meat? So I don't know. I have to actually sit down and now research whether vegans have a higher or lower risk of miscarriage. Based on this, I would anticipate maybe they do have a higher rate of miscarriage. So that's something that we need to explore. I don't know it, so we'll have to check it out. Cereals and grains, like I mentioned earlier, 33% reduction, so 1/3 reduction in your miscarriage risk. Again, that's huge. Fat and oil, neutral. It didn't show a risk at all. Sugar substitutes kind of trended over to a higher risk, but it wasn't significant. So all of this, super important, all demonstrating that there is an impact on your miscarriage risk from your diet. So the key findings here, again, the ones that I kind of summarized there for you: fruit, vegetables, obviously fruit and vegetables, white meat like poultry, seafood, dairy products, eggs, and cereals and grains, all beneficial, okay? Red meat, we don't know. And none of the dietary changes increase your risk. So again, we're not blaming anybody here. This isn't about saying you had so-and-so, so it increased your risk. We're actually talking about things that can decrease your risk, so we want to focus on that. When they looked at the cohort studies, that did present slightly different numbers. So the fruit was very, very significant. Again, here you're looking at 61%. Vegetables, again, very significant, 41%. But when they combined fruits and vegetables, it was only one study. It did not show a difference in this case control study. Meat, a little bit more trending towards a risk. Red meat, same thing, kind of a little bit more trending towards a risk. White meat did not show a benefit there in the case control study. Seafood still positive. Dairy products still very positive, a 43% decrease. Eggs still positive, a 30% decrease. Cereals and grains, a 43% decrease again. Fat and oil, no difference, but sugar substitute had this insane increase in miscarriage risk at 7.5 times the baseline risk. So if I flip back to the other one, you can see it was a suggestion in the cohort study. It kind of trended that way, but it was not significant because it crossed that bar. But in this case control study, there was this massive increase with sugar substitutes. So if you're thinking about having sugar-free drinks or, sugar-free pop or something like that, don't. I can't tell you that this is enough data to kind of put the nail in the coffin of those substitutes, but I certainly wouldn't take it based on how significant a risk this demonstrated, because we know that they're generally speaking not particularly good for you, and certainly in this circumstance probably should be avoided. So if you need to have something with taste, and you like as a drink, or as a something that you want to eat and you're trying to avoid high amounts of sugar, just look for low kind of sugar fruits, things like strawberries, and focus on those. And if it's in a drink, just dump some fruit in your water. You're going to get minimal sugar from it. You'll get the flavor, and you're getting all the benefits of the water plus whatever vitamins your fruit releases. So that's probably a much safer way rather than trying substitutes, so that you can have, a can of Diet Coke or anything else like that. And then they did kind of summarize it with these dietary patterns that they looked at. So in their dietary patterns, when they looked at the prior data, an a priori analysis, they actually didn't see any differences with anything until they got down to the bottom ones down here. So they got a prime diet quality score, and it's a specific type of diet that they were looking at, and you can find these online. I won't get into them tonight in too much detail. That did show a reduction, and that reduction was very significant. You're looking at a 47% reduction. The dietary inflammatory index, so if you were taking diets that were potential, there was a 2.12-fold increased risk of miscarriage, and that was significant. If you had a high antioxidant diet, so again, lots of vegetables, lots of fruits, lots of vitamins, you were looking at a 57% decrease in miscarriage. A balanced diet in the kind of post hoc analysis, a 27% decrease. And the processed diet, again, showed this twofold increase in risk of miscarriage. So if you're taking foods that are heavily processed sugars, processed fats, things like that, you're going to end up with a higher risk of miscarriage. So is it a fact or fiction that your diet can actually impact your miscarriage risk? It is actually a fact. I can stop sharing, I guess, if you want, or you can stop sharing. So it is actually a fact. It does very much look like your diet can control or at least contribute to your miscarriage risk. And therefore, it does need to actually be factored in to your decision process in terms of what foods you choose to have, what diet you choose to follow. As a general rule, while you're trying to get pregnant, we do advocate for that Mediterranean diet. Fresh fruits, vegetables, reasonable non-seed oils like an olive oil. Focus on having fish rather than meat if you can. Some eggs, some dairy, that's all going to be very reasonable for you. There are people out there who believe that dairy is the devil and that it causes lots of inflammation. There are studies that do support that. I don't question that. Nevertheless, this study is showing that it does reduce your miscarriage risk. And I think a diet devoid of dairy is probably not necessarily a balanced diet. So there are things here that are important to learn from, and hopefully that'll help you guys in your journey moving forward. Do I think that this is the be-all and end-all of miscarriage? No, of course not. Remember that 60 to 80% of miscarriages are caused by a genetic problem. It won't make any difference what your diet is if it's a genetic problem. So don't blame yourselves. Do not hold yourselves responsible, but certainly make good choices moving forward so you can get to where you want to go. I hope you enjoyed that segment. Let us know your thoughts. Make sure you like, comment, and share. We always appreciate the comments. It helps us get better and better all the time. And that's it for that part. We will now take your questions. I'm assuming there are some. We actually, last week when you weren't there, slacker, we actually got through all the questions.
Because I wasn't here.
Maybe it was because you weren't here. They must have missed you, yeah. All right, fire away.
First question.
Yeah.
Stevia, is that bad too?
Yeah, I don't know about a relationship between stevia, because stevia is a natural sugar. It's not an artificial sugar. So, you know what? We can look that up.
Do they say what sugars they tested for that? Like it was
I'd have to go look at the individual studies. This just says, artificial sugar. I will look it up while you guys.
I'll give you another one.
Yeah, give me. Well, actually, you know what? Hang on one second. Let's see. Let's see if we can find it here. It won't take me more than a minute.
Okay.
We'll go to PubMed, and yes, I'll log in. And we're looking for stevia and fertility. Well, apparently it can act as a contraceptive in adult female rats. So that might not be good.
Really?
Yeah.
Wow.
Here's one. Human doses of aspartame. Oh, let's try this one. Let's see what this says. Okay, this study aimed to investigate the interaction between obesity, low-calorie sweeteners, and prebiotic oligofructose on reproductive parameters in rats. So they had rats, some lean, some obese. They gave some of them aspartame, some of them stevia, and some of them just a prebiotic. So obesity significantly reduced pregnancy index in obese dams. So if you were fat, you had less chance of getting pregnant. Compare with lean. Obesity also reduced the number of pups born. Only 53.3% of rats were able to conceive in the obese plus stevia group. But if rats did become pregnant, they had a 100% pregnancy and delivery index. So once they were pregnant, it didn't cause miscarriages, but it was a drastically reduced chance of success. So both obesity status and dietary ingredients affect the ability to conceive. That's about all it says. I would just stick with sugar. I mean, if you're going to have sugar, have sugar. Just don't have a lot of it.
Go for the real stuff.
You know what? That's my belief. I kind of believe in that in general, too. Yeah. Although you and I get 90% of our sugar from chocolate. Hey, what time can you eat?
Now, but let me finish this question first.
All right. Okay.
Hi, doctor. If you have adenomyosis, what treatment you can stay pregnant?
Well, you can't take any treatment to control adenomyosis and to keep you pregnant. Treatments for adenomyosis involve blocking estrogen, and estrogen blockers like GnRH agonists or antagonists, letrozole, all prevent you from getting pregnant if you use them consistently. So the only thing you could try are supplements that are good for endo, because adeno and endo are very similar. So those are supplements that are, beneficial in endometriosis. So alpha lipoic acid, which we reviewed last week, curcumin, bromelain, resveratrol, coenzyme Q10, and NAC. Now, does that work? There is no evidence that those work for adenomyosis that I am aware of. And certainly nothing I've ever seen that suggests that using those will prevent a miscarriage in pregnancy. So I don't have any evidence to support that, but they are useful for helping people get pregnant in endo cases. We don't know about adenomyosis cases. Good question, though.
What type of doctor do you recommend for isthmial correction? Uterine surgical specialist, or is any RE capable of doing a good job?
Oh, God, no. Not all REs are good surgeons, so no. You definitely need to see someone that is a good surgeon. Now, some REs are great surgeons, and some are not great surgeons. So make sure you are seeing someone that is extremely experienced in minimally invasive surgery. So I'm a minimally invasive expert. So there's nothing I can't do minimally invasive. So you need someone that can do that. There are other REs like me who have that same skill set. My classmate in residency also became a fertility specialist. He's a phenomenal surgeon. I would trust him with any member of my own family. The guy is great. But you can't say that about everybody. So make sure your RE has lots of experience doing isthmial repair. It's not something that should be attempted by everybody. And it also depends on the nature of your isthmial. If you need laparoscopic suturing because they're actually removing the whole tract, like a cesarean section all over again, That is not something you just get anybody to do. That's something you get an expert to do. So make sure you're seeing the right person for what you need.
Dr. V&T, hearts.
Oh, excellent. I don't think the young lady last week got any hearts. I did introduce her at the start, but they don't love her like they love you.
Well, that's might be expected. Might be expected. How do you accurately diagnose adenovirus? Oh yeah. This is a different question, oddly. How should IVF treatments be tailored for endo and adeno? Is adeno linked to recurrent losses?
Yeah, so I mean, I am one of the people that believes that adeno and endo require different treatment. There are many fertility specialists that say that it doesn't make a difference, and there are some studies that say that endo patients do the same as non-endo patients, but physiologically, that just does not make any sense to me. And my rationale for that is this. Endometriosis and adeno are both estrogen susceptible diseases. So they grow in the presence of estrogen. And when is your estrogen particularly high? When you're either doing a fresh IVF cycle where it should be really high, or ideally is getting high, or if you're doing an FET with a hormone replacement protocol because, again, your estrogen is really high. So neither of those to me make sense for those exact reasons, especially in those populations, because I don't do fresh transfers in most patients, but I definitely don't do them in endo patients because the endo is maximally inflamed. So you can show me 100 studies, but I'm just going to point to the fact that it would not make any sense. And we do have studies that are wrong. The Women's Health Initiative probably being one of the best ever, where they came out and told everybody to stop doing hormones and then found out afterwards, well, actually, estrogen alone is really quite good for you. So, and the risk of cancer from estrogen and progesterone wasn't nearly as bad as they thought it was. And heart disease was only present in women with risk. So we get it wrong sometimes in the studies. And so you have to rely on some degree of common sense. So what do? We have a whole endo protocol. What we do for our patients, and I'm not recommending to any of you that you do this because you need to talk to your doctor. I'm just telling you what we do for our patients. So for our patients, we use Lupron first for 3 months plus letrozole. Then we use a letrozole protocol for their lining thickening when we're doing the embryo transfer. And this is just for embryo transfer. We use lots of supplements, so all 5 of the ones I mentioned earlier: curcumin, NAC, coenzyme Q10, resveratrol, and alpha-lipoic acid now. We try and avoid any estrogen supplementation if we can. If we have to, we use a minimal dose, 1 milligram a day, 2 milligrams a day maximum. And then we do our embryo transfer with high-dose progesterone, which was from a study we reviewed here a few months back. I think that was about 2 months ago. And that showed that you need a higher dose of progesterone to succeed with those endo patients. So everything we do is based on the studies we've reviewed and on some degree of logic. And those things tend to lead to good outcomes for us, and we do very, very well. I also advocate for surgery for patients that have bad endo. I mean, it makes sense. There are lots of studies that show that surgery prior to your IVF improves your chances. So if you have access to it, if it's safe, if you have a good surgeon, if your risk profile is appropriate for it and you've reviewed it with your gynecologist or RE, then yes, it is something that should be considered. Am I telling you to run out and do it? No, but it is something that you need to discuss with your specialist. A lot of specialists don't want patients to go get surgery because A lot of patients will get pregnant from the surgery and don't need IVF afterwards. And B, a lot of REIs don't have time to be operating, so they don't operate. And because they don't operate, they end up missing out on those patients because now there's a delay and they look at it from an income perspective and say, this is a bad thing for me. Well, I don't do that because I don't care about the money, so I operate on all my patients that need surgery and I do it all myself. But make sure you're seeing the right people for what you need and what you want. Happy fast breaking. I cannot remember how to say that in Arabic. What is it again?
I don't even know we have a thing for that. There's a thing.
You do, yeah. There's like you broke your fast.
Oh.
Yeah, you didn't know.
Break and enjoy.
Keenan told me, but I can't.
Oh, really?
Yeah, I can't pronounce it for the life of me. Yeah.
People are just excited that we're back together again. Hi, Dr. B&T.
Yep.
I'm a patient at your clinic,
Okay.
and I'm getting for a FET.
Okay.
I got my Lupron injection today.
Yep.
How much longer until the transfer with your protocol?
Oh, it usually takes about 3 or 4 weeks. You'll have your period in about a week if you got your shot today. And then we start your meds a few days later. And then it depends on how long it takes for your lining to mature. But the average would be somewhere between about like 17 to 23, 24 days into your next cycle. So add that plus the 7 days till you get your period. So yeah, a reasonable number of weeks, like 3 or 4 weeks from now.
Hi! Exclamation mark.
Hi back! Exclamation mark.
Do you recommend inositol for women without PCOS preparing for IVF and I can't improve egg quality? Do testosterone levels, if they are low, weigh into the decision to use inositol?
I don't, because I'm not aware of any evidence that supports doing that. I would never bother looking at your testosterone levels in relation to inositol because that's not why we use it. It's more for its anti-inflammatory and insulin sensitization parameters. So no, I don't look at testosterone, and I don't recommend inositol to women who don't have PCOS. Not yet. I mean, maybe if more studies come out suggesting it's beneficial for that, but not with the current batch of data that's available.
Hi, Dr. B.
You were left out. I'm sorry, bud.
I felt it.
And you look sad for a minute.
Yeah, there was a tear. If dairy lowers miscarriage rates,
Yeah,
should people with endo
yeah.
attempt eating dairy or not?
The endo and dairy thing, I need Jen Strong here. Jen, if you're watching, feel free to comment and Tarek will pick it up or text me and I'll pick it up. So the endo and dairy thing is complicated, guys. I don't read that data enough to feel confident answering that. And that's more of a naturopath approach to things. Like I said earlier, there are people that believe that dairy is the devil and that it should be avoided at all costs. And there is some contamination of all sorts of chemicals and, hormones into the dairy chain, so to speak. So yeah, there are probably situations in which it's not ideal for endo patients. I guess once you're pregnant, can you switch back to being on dairy? Now you're discussing whether inflaming your endo is worse than, trying to mitigate the miscarriage risk by having some dairy. I don't think there's a winning argument there. We just don't know enough in that specific population of patients. I don't believe in dietary elimination. I will tell you that. I think people that have these extraordinarily restrictive diets are just not doing the right thing. It's impossible to maintain. It's probably not healthy for you as a general rule. And so, there's lots of people saying, including one very famous fertility specialist, who claims that you should only eat one meal a day and all this stuff. I mean, that stuff is just simply not the case. It is bad for you. And they're citing that, human beings 2 million years ago, we could probably only eat once a day. Yeah, and the lifespan was like 17 or 24 years. We got lots of people living over 100 now. So clearly what we are doing now is better than what we were doing before. And so I don't believe in dietary elimination. I don't think people should just all out abandon dairy because they've got an endo. Should you minimize it? Sure. But do you need to abandon it? No.
I have an interesting comment for that.
Okay.
So this is not medical related at all.
Okay.
If there was ever a disclaimer to be underneath speech, this is it.
All right.
So I'm sitting down with this one guy, and he's telling me about the water in his home.
Yeah, of course.
Right?
Yeah.
Of course, right?
Yeah.
And he tells me he's got sulfur in the water, he's got iron in the water, and he's got his wife and his kids, and they're all living with this sort of a water situation.
Right.
I make a face, oh my God, it's gross. You should do something about it. And he goes, well, we don't drink the water. I'm like, well, I'm happy to hear that.
That's good, yeah.
Good.
Sure.
So what do? You buy bottled water instead? He's like, no, we just drink milk. I'm like, what do you mean, just drink milk? He's like, I work at a dairy farm.
And they just drink milk.
And they strictly drink milk.
That's it.
That is their drink. They don't drink pop. They don't do. They might do juice, but they absolutely only drink milk.
They don't have water.
They don't have water.
He's getting a kidney stone, man.
Something's up. Something's up. But
yeah,
for
I don't.
What it's worth, he looked all right. He did when you imagine someone that drinks a lot of milk, you always imagine them a little bit thicker. You know what I
Yeah,
mean?
sure.
Like I always imagine, like you got
Oh,
strong, healthy milk
maybe he's
bones.
having, skim milk. Who knows?
Yeah, who knows? Yeah, absolutely. But I just want to share, like I know a guy that's living off milk,
What?
according to him anyway. Again, non-medical
Yeah.
asterisks everywhere, but
Ex-
somewhat related.
Let's see excessive dairy intake.
But dairy could be considered ice cream, which is also, gotta stay clear of that.
Yeah, that's healthy though, man. I love ice cream. Um,
He's living, I'm telling you. He looked all right.
there's nothing on excessive dairy intake. I'd have to do like a deep dive into this. It's probably going to go back a while. Okay, go ahead. Next
Yep.
one. Yeah,
Food for thought.
yeah,
Hi, Dr. VNT.
yeah.
What are your thoughts on the use of Viagra to reduce NK activity?
Yeah, there's lots of cells showing that Viagra decreases NK activity, and I do talk to my patients about it. So there are studies that demonstrate that Viagra is actually very useful for reducing NK activity. There are also studies that show it doesn't. I don't know if there's a meta-analysis on it. I haven't looked at it for a long time, but we do offer it.
Yikes. Those of us with diabetes should stick to water only, it seems.
Yep, avoid the sugary drinks for sure, and the fake sugar drinks too.
Do gluten impact miscarriage? Should gluten be avoided ahead of an FET?
Yeah, again, I think that's a dietary naturopath question. I will admit to you guys, I mean, I look for the scientific articles. I don't sit around all day long and study nutritional things in relation to fertility, because I leave that for people like Jen Strong and Caitlin, our nutritionist. But there are people that believe that gluten causes enough inflammation in the body that can increase the risks of miscarriage for sure. I'm just gonna see if let's see if there's a systematic review. Celiac disease, sure. They've got one there. I can pull that up real quickly. Well, this is backwards. This is basically saying that if you have celiac disease, you have a higher risk of having infertility. They said it was not a really well done study. So, the gluten issue is also, again, complicated. And again, I always see these fads throughout my years of practice now, which are sadly more than I want to admit to. I see these fads where, something becomes all the rage and people abandon dairy and then they abandon gluten. And, if you keep doing like dietary elimination therapy, you're going to be left with nothing. Like it's impossible. So I don't think that makes sense unless you truly have celiac disease. Obviously, if you have celiac disease, you need to avoid gluten. But people are being told nonstop, left, right, and center, that they should be taking no gluten whatsoever. And that can't be healthy either. So I think that there's not enough data for gluten and miscarriage. But again, I'll reemphasize, this is just me personally, I don't believe in dietary elimination therapy. I just don't think it makes sense. Reduction, sure. Control, absolutely. Am I going to give up chocolate? No. I'm just not.
It's not happening.
It's not happening. Yeah. There is nothing that's going to make me give up chocolate. Yeah.
Dr. V,
That's me.
does your lab have the capability of maturing an egg in the lab if immature at retrieval?
We do. You kind of need to prepare for that in advance. You have to know that the patient's going to have a problem because it requires special media. But if we have that media available, yes. Do we have that media available all the time? No, because it is psychotically expensive, and it only lasts about 2 weeks or 3 weeks. So we can't keep it around all the time, because if we don't use it, we just wasted thousands of dollars. So if we know you've had a history of immature follicles, yes, we will keep it here. Having said that, we do have some success in maturing follicles that are like M1, and we use those and we'll fertilize them. So we do mature the ones we have. If you're talking about getting a germinal vesicle, which is like a very immature follicle, to maturity, you need special media for that. So that we have to know in advance. But yes, we are capable of doing it. And actually, my lab director's publications are actually on that, on maturing follicles in vitro.
Really?
Yeah, remember we were doing it on the website the
That's
other
what it
day.
was.
Yeah.
How cool.
Yeah.
Thoughts on varicose repair for a couple with otherwise unexplained RPL? There's a normal semen analysis. Change thoughts on this.
Normal semen analysis wouldn't, because if you're experiencing RPL, the question is there high sperm DNA fragmentation? So I would do a sperm DNA fragmentation test. If that's elevated, yes, I would do the varicocectomy.
I'm 6 weeks, 2 days, and have been
Congrats.
spotting 3 times
Oh.
since 4 weeks.
Okay.
Is this normal to spot that often?
Spotting is never normal, but it's not necessarily a sign of something bad. We have a whole video on YouTube on first trimester bleeding, so watch that. It's not always necessarily a bad thing, but it's never a normal thing. So you should always be investigated, because you have to rule out problems like ectopic pregnancy, or a miscarriage that's in a bad place, like a cervical ectopic, or a cesarean scar ectopic. So with all of those things, make 100% sure that you are seeking the advice of a physician. It's also very important that you know your blood type. So these are things that have to be addressed and looked at.
Hi, Dr. V. All ultrasounds showed my uterus as a normal size. However, after I fell pregnant, my doctor told me that during my embryo transfer, she observed that my uterus is small. She didn't say much. Will this affect my pregnancy? I also just found out I had a vanishing
Twin syndrome. Yeah.
at 9 weeks. Can this be related?
There's no way for me to answer if your vanishing twin was related. So that's not something anyone could tell you. We do know that studies show that women that have a low volume uterus, meaning the inside of the uterus is small, have a higher risk of miscarriage. The question then becomes, is it related to the shape of the uterus? It can be. T-shape, Y-shape, septum, even arcuate have all been associated with increased risks of miscarriage, and they definitely have a smaller volume. So it's hard to know if that's a volume issue or a shape issue. I guess my answer, or I guess my question back to you would be, why did they not know that ahead of time? Because we check all our patients before we even ever start their fertility treatment. So I'm confused as to why they would figure that out at the time of embryo transfer. I need to know more details about that. It doesn't make sense to me. There's a piece of that story that's missing.
Thoughts on intralipids? Have one embryo to transfer doing letrozole prog sup protocol.
Yeah, so I mean, it depends on who you talk to. Intralipids for all comers is not something people do. Intralipids for patients with recurrent failures, a history of natural killer cell overactivity, or increased numbers of natural killer cells, a variety of other conditions. Yes, intralipids can be very beneficial. Intralipids for just everyone, no, that has not been shown to be beneficial. So if you want to do testing to make sure you need intralipids, I think that's great. If you're just going to blindly use intralipids because you only have one embryo, we don't know of any harms, but I can't say that it would be beneficial. So you really need to talk to your doctor about that.
I gotta get a charger for my phone real quick. Hi, Dr. V and T. Any general thoughts on varicose repair? Oh, sorry. Hi, Dr. V and T. Oh, they asked it multiple times. Hi, Dr. V and T. I'm a patient at your clinic. I'm getting ready for a FET. I had my Lupron injection today.
You answered.
Oh.
Yeah, we did
If
that.
no menstrual seen on ultrasound for a day 3 ultrasound, do you proceed with stims if MDL already started? What if there's a corpus luteum present, so spotting would have actually been from spontaneous ovulation?
Wow, that was a long question. Go grab your cable. Do you have one?
Yeah.
So yeah, that's a complicated question. So it's got a good answer though. We know from studies that, especially cancer studies, that you can start stimulation for a patient at any point in the cycle. You no longer need to wait until the patient is at the start of a period or in the luteal phase. You can random start people, and that's what we do with cancer patients. So when we get sent someone who has cancer and has very little time to do their stimulation before they need to start chemo, we just randomly start them. It doesn't matter where they are in the cycle or what they're experiencing yet. We just go ahead and we start their cycle with no risk of adverse outcome. So you can randomly start people and go ahead and get very good results without having to worry if there's a corpus luteum, which we do all the time now with duostim patients, or worrying about whether or not you've had a period. It doesn't matter at all. You can go ahead and do whatever you need to do. You were like dead.
It just happened. It just wore out.
It's like gone.
It just went gone.
All right.
Okay. So for the Instagram,
Yeah.
Instagrammers,
Uh-huh.
their questions kind of vanished at that point.
Uh-oh. Would it be there if I...
Yeah, bring up your phone real quick. Because now that we have the sharing of the screen,
Yeah.
I can't open up another window.
No, I gotcha.
So I used to have Instagram
Oh,
here.
it's...
Oh, that's really convenient. That's so funny.
That's not going to work.
That's not gonna work.
Oh, well, I can email it to you. Do you want me to have it emailed to you?
No, because I'm sharing my screen. I can't move
Oh,
my
that-
screen. I can't do a single thing.
We're scuppered.
Yeah.
All right.
How funny.
No worries.
Oh, use your other one.
My other account?
Yeah. Just to log in and watch the live show. And then
Yeah,
the
but
questions
I
will
won't-
populate there. No, just to get the questions.
Really?
Yeah.
Okay.
You don't need that account right now.
Okay. So I need to go find myself, though.
Yes. Just give it to me. I'll do it for you.
Hang on. I got it.
And in the meantime, hello, my dream team, Dr. V and T. Thumbs up, hearts, all wonderful things.
Okay.
Have you ever done cervical cerclage?
Cerclage. Yeah.
It looked like cerclage. To help sustain a pregnancy. I have stage 4 uterine prolapse, and my cervix is usually lacerated and filled with Nubian cyst.
Nabothian cysts.
Nabothian cysts doing IVF soon?
Your phone's coming on. And those are the questions.
These are all the questions. So,
Yeah.
just from now on,
Yeah.
everyone just ask their questions again if they weren't asked on Instagram. Like from this
Okay.
moment. So like,
Re-ask all the questions on Instagram?
yeah, if it wasn't asked on Instagram,
Okay.
Yeah.
If you had questions on Instagram that we didn't get to, feel free to ask again and I will answer. If not tonight, because we're running out of time, then I will address them individually like I did
that's
last
the
time.
downfall of the sharing of the screen.
It gets complicated. Yeah.
Yeah.
Okay. So, yeah, I don't do cervical cerclage, but my colleague is probably one of the best ever at it. He's amazing. Dr. John Toms. He does rescue cerclage. He does prophylactic cerclage. Do I do them? Yes. In instances where patients have had a second trimester loss because of cervical incompetence, we do them all the time, and we have very, very, very good results with Dr. Thompson's cerclages. So God bless you, John. You don't watch the show, but we love you. And is it indicated for prolapse? No. So prolapse is not a problem leading to cervical incompetence. Prolapse is just the uterus kind of coming down too far. Why would your cervix get lacerated? I'm confused again there, so I would need to understand that better. But there are ways to prevent prolapse. You can put a pessary in pregnancy. It actually prevents preterm labor too. So there are things you could do to treat that. So I would need to know more details about you. If you're my patient, definitely talk to me. If you are somebody else's patient, make sure you talk to them about the risks and benefits of cerclage, whether it's appropriate for you, what the data is, and how to manage your stage 4 prolapse.
Time the question. Will your lab freeze embryos with C qualities? My current lab does not freeze anything with a C.
Yeah, we're in debate about that. It depends on how many other embryos you have that are good quality. So we don't normally keep the C's if we have other ones, but if we don't have other ones, we will keep the C's. But we're debating it because a euploid CC embryo still has a reasonable chance of success. It's not amazing, but it's reasonable. So we'll probably start keeping our C quality embryos as well.
Somebody said, I'll text Dr. Tom your praise. LOL.
Oh, excellent. He's amazing. He's a very blessed guy, and Tarek knows him as well. He's a very good human being, and I love John. He's a great person. His heart is in it, his spirit is in it, his soul is in it. He's a very godly man, and I love that about him. So, yeah, and he's a phenomenal surgeon. I mean, the guy is an amazing surgeon. I do joke with him, and he jokes with me because we share the same OR day, and we're often across from one another in the OR. So we go in and tease each other endlessly, but he's a phenomenal surgeon. I mean, that guy is good enough to operate on anyone for anything. He's very skilled.
How long after microsurgical varicocele repair is it reasonable to undergo IVF?
Well, after you see what the sperm performance is like, it takes 3 months to make new sperm. So you'll start seeing the benefit after 3 months. But it might continue to improve. It depends. Typically, what I've seen with people that have had varicocelectomies is that there's like a blip where their sperm improves for a little bit around that like 3, 4, 5, 6 month mark, and then it goes back to what it was before. That's typically what I see, but you'd have to talk to a urologist.
You did my surgery. I'm on all the meds and vitamins you just said. Can't wait for my transfer.
Awesome.
Dr. V, hi.
Hi.
My transfer is next month with you.
Okay.
I am on ASA 81 milligrams. Until when I should take them?
Till you have your baby in your arms. Easy.
Nice, easy.
Easy. Yeah, super easy. Till your baby is in your arms. Stay on the aspirin. Yeah. Aspirin has loads of benefits. We have a great video on YouTube on aspirin and fertility. It's good for the fertility component. The studies show it's also good for preventing preeclampsia. We know that, and it's very good for preventing preterm labor. So you should be on aspirin.
When in a cycle do you start the Lupron letrozole protocol? My current RD says in luteal phase. My previous doctor said around day 3. Is there a difference?
It depends on which Lupron letrozole protocol you're talking about. If you mean an endometriosis protocol, 3 months in advance. If you mean just for frozen embryo transfer, we start the Lupron on day 21 and the letrozole on day 3.
Do you recommend using any anti-rejection medications like tacrolimus with RPL?
In instances that are appropriate as an indication for use of tacrolimus, yes. So if you've been tested and your cytokine ratio, your T helper 1, T helper 2 ratio is off, we do use tacrolimus in those groups. And there are studies that demonstrate that it is beneficial. Do I use it just indiscriminately for people? Never. That's wrong, in my opinion. You should not be taking drugs without an indication. So I don't do that.
Can a strict elimination diet 30 days prior to a FET negatively impact implantation?
I do not have any evidence to support that a strict elimination diet, either positively or negatively, will impact your implantation. Like I said earlier, I don't believe in elimination diets. So I'm not aware of any studies. If anyone is aware, shoot those to us. You know who we should ask? Ruth Corey, the PCOS specialist. Maybe she'd know. She's a certified nutritionist.
Yeah.
Let's ask Ruth.
Let's ask her.
Maybe we'll get her back on and ask her about women with recurrent pregnancy loss and diet changes. Yeah. Yeah, although her specialty is PCO, but maybe she knows about that stuff too. She was awesome. I loved her.
She was good.
Yeah, she was really good. Yeah, yeah. And all her food looks like so...
Oh, yeah.
She's got some filter on that camera,
There's a
man.
filter on the
Yeah,
camera, 100%. There's
she
a
could be
filter on
having
the
chewing gum, but it just looks so good on the camera.
What prenatal do you recommend pre-pregnancy?
We have a video on that too. It's called The Good, the Bad, and the Prenatal. So you can watch it on YouTube. All we did was compare the different vitamin contents. So I'm not going to tell you what I recommend because technically as a Canadian physician, we're not supposed to recommend any particular brand of anything. However, the ones with the highest vitamin contents that we were aware of were NFH SAP prenatal and Pregvite Folic 5. We do use those a lot. I'm not allowed to recommend, but I will tell you that those are the ones we typically use.
Do you use Overdrill in FET with letrozole?
No, I don't. I don't see the point of it. There's no need.
What would you have in place for a type 1 diabetic to prevent autoimmune response to implantation?
Yeah, that's a great question. So those are cases where you've got to be super careful. If you use steroids, you'll make the sugars go crazy, so you got to be very cautious. Those are situations where things like intralipids, subcutaneous IG, potentially low dose steroids with very tight sugar control might be considered. So there are some things you can do. The most important thing for those patients, super tight sugar control. That's going to do more than anything we do. So there are various options available, but again, these are things that you need to review with a reproductive immunologist. It's not something you just take. So you have to discuss them with someone that's either an RE with some expertise in that, myself, I guess, or an RI, like my buddy Fred Zaneku, who knows this stuff inside out and backwards.
Regarding the, do you store the C eggs?
Yeah. Yeah.
And do you think a 6BB is a risky embryo in terms of transferring into another clinic and thawing?
So there's no risk to thawing a 6. The problem with the 6 is they're extremely sticky and they can stick to the inside of the catheter during a transfer. Yes, you need to have a clinic that knows how to manage them, but as long as the clinic that froze them have followed a logical, reasonable protocol, there's no reason why you can't do the same.
Can you surgically remove adeno, not a hysterectomy, but to conservatively preserve the uterus?
Adenomyosis comes in two forms. There's little flexin nests of it, they call it, which are very small. And then there are like kind of clumps of it, which is like a tumor, which actually often looks like a fibroid, although you can kind of tell the difference on an ultrasound. So the clumps you can remove, although I got to tell you, there's no surgery I hate more than that surgery, because there's no margin. It's like a tumor, like an invasive tumor. You literally can't tell what's what part's normal, what part's not normal. It's horrible to deal with, like genuinely horrible to deal with. Having said that, it is doable for the adenomyoma, which is like a tumor of adenomyosis. But for the nests, no, there's no way to remove those because there's lots of small little splotches. You destroy the uterus trying to get it out.
Do you use N-Rigel and DHEA together? Does this improve egg numbers and quality?
We frequently do, and the data supports individually, not together, that there are benefits to using those products. So again, you got to check all this stuff with your doctor, but there are studies that support a benefit for testosterone. There are studies that support a benefit for DHEA. Do I use them together? I do.
Dr. V.
1 minute left.
Thoughts on still doing fresh transfer when you don't know if you menstruated or not prior to starting stims?
We don't do a lot of fresh transfers. In fact, I don't believe in fresh transfers because the data is, in my opinion, overwhelming. The frozen embryo transfers are better outcomes and higher chances of success. I can tell you right now that with one euploid embryo across all ages, we're getting an 82% success rate with just one. So why? And they're all frozen. So why would I do that with fresh? Like, it just doesn't make sense to me. So we are doing very little. The only time I believe in fresh is for patients that are doing natural cycle IVF. It makes total sense in a natural cycle IVF cycle. But frequently those patients need PGT, in which case you can't do a fresh transfer. So it becomes complicated, but I do believe in it in that group. And everybody else, if you're making multiple eggs, it just doesn't make sense. Those high estrogen levels we know have a negative impact on the pregnancy risk, preeclampsia, IUGR, growth restriction, all of that stuff. Are you starving? You got to be starving.
I can handle myself. I'm a big boy.
You want one or two more questions?
Yeah, cause there's just a couple left, and I feel like we kind of,
Screw
did it
people.
wrong by,
Okay, all right,
that
go
one
ahead.
there.
All right.
Not necessarily saying that these are the same questions either. Like God knows, right?
Right.
But we'll get this guy here. Is NIP necessary when PGS embryo is transferred?
NIPT, NIPT?
NIPT.
Yeah.
NIPT.
Non-invasive prenatal testing.
Uh-huh.
Yeah. Is it necessary? I mean, that's a personal question, right? So the error rate with NIPT is probably less than 1% with most labs. So do you need NIPT? Probably not. But if you want to be extra sure, the error rate with NIPT is extremely low. It's way less than 1%. It's 0.0001%. So it's got a 99.9999% accuracy. So if you want that extra accuracy, go for it.
Hiya.
Hiya.
Yeah. With a bunch of Y's and a bunch of A's.
Is our friend from Holland or wherever did she come on tonight?
You know,
I'm disappointed.
I recommend going back to the telephone.
Oh, really? It's not the same on TikTok?
It's not.
Oh.
It's just not.
All right. I wonder if it looks glitchy. We should look and see.
You can't watch it.
You can on that one.
No, because that's your profile.
Well, you can watch it.
Well, normally.
I wonder if it's glitchy.
It looks decent. Ask them.
If you're watching us on TikTok, let us know if it's glitchy or not, because we need to know to figure out which way we do this. Anyways, go ahead.
Yeah. Back to Haya, because that was very funny spelling.
Yep.
Would you recommend uterine PRP for FET? I have no lining issues, but only one normal embryo and want to do everything I can do to make it successful.
So I can't tell you in that scenario. All I can tell you is the studies that looked at PRP for the uterus are in two groups. One is for thickening the lining, which it does show a benefit. And the second is for unexplained failures, unexplained previous failures, which showed a huge benefit. And we've got that as a study we shared on our YouTube channel. So I can't tell you whether or not you should do it for you with one embryo. Have a look at that study and see if you think it's convincing enough to do it. And talk to your RE always. I'd be happy to give you my personal opinion, but you need to be a patient. So contact info@drvictory.com. Ask for a consult and I'll happily tell you whether or not I think you should. I can't do it on social media. It's not allowed.
Is there any risk? I feel like I asked this, but just double check for me. Is there any risk to moving embryos from one current clinic to
If it's
another
a 6BB?
clinic? No.
Oh,
Not happy at current clinic and have 4 employed there.
no. There's virtually no risk unless some catastrophic car accident happens and it takes days to get the tank out. No, there's no way. The tanks are very solid, okay? The tanks they ship the embryos in are very solid. And then that goes in this plastic outer canister, which is like basically indestructible. And it's all locked and zip tied and all sorts of stuff. And it's like very, very difficult to see damage. We get embryos weekly from Australia. So in Ontario, moving embryos, that's like a joke. It's not a big deal.
So they say it's a bit glitchy on Instagram.
On Instagram.
So it could very well be a bit glitchy on
So maybe it's
be a little
glitchy.
bit-
Yeah. Okay.
little bit
Interesting.
heavy, yeah.
Maybe you might need a stronger computer, buddy.
There's one I want to get, it just didn't come out yet. I don't know if I should buy one. To hold me over.
Yeah.
What does it mean when you have a 1BB embryo?
Well, it depends on which grading scale is used. So typically the number refers to the degree of expansion of the embryo, but unfortunately, one grading system is the reverse of the other. So the most common one, a 1 is a very, very compact embryo, and a 6 is fully hatched. And in the other grading system, a 1 is an expanded embryo and a 3 is a really small embryo. Then the first letter responds to the quality of the appearance under a microscope of the portion of the embryo that's going to become the baby, the inner cell mass. And the other letter, the second letter, refers to the quality of the embryo by microscopic appearance of the portion of the embryo that's going to become the placenta. So the grading scales are pretty uniform. A is the best, B is very good, C is not so great, and D is a disaster. But the numbers, it depends on which grading scale they're using. So if you're at somewhere like Create, a 1BB embryo would be really good. If you were somewhere like with us, a 1BB would be a disaster because that's an embryo that basically didn't expand at all. Not a disaster, but it would not be great.
TikTok is much less glitchy than Instagram tonight comparing the two.
Oh, wow.
That is so weird.
That is weird.
Right? That is so weird.
Thank you guys for watching on multiple platforms. That's cool. I personally want to just move us strictly to YouTube. I like YouTube the best. And we keep growing on YouTube. We have millions of views on YouTube. And it's just,
nice.
it's easy. It's easy. Yeah. Yeah. YouTube's good. Anyways, fire away.
I think this is day one of Pincushion Protocols complete.
Hi, Candace.
You're good.
I'm very good. Yeah. Yeah.
How long would you recommend a patient stay home when exposed to parvovirus?
Parvovirus?
Parvovirus, yeah.
When exposed?
I'm a teacher and 13 weeks pregnant, not immune.
Oh, past 20 weeks. Parvovirus is a risk up until 20 weeks. After 20 weeks, it's not a risk anymore.
Look at you, immunologist, OBGYN.
That's just OB. That's not rocket
That's
science.
easy, eh?
Yeah.
For what it's worth, I didn't know it.
There are a lot. I love the fact that you say it with a straight face. Yeah. Yeah.
I didn't know it. I think this is the last one.
Okay.
Where can we submit our questions?
Oh, that's a question? Listen, if you didn't get a chance to have your question answered, submit it to us either via DM or Tarek can put up one of those posts where it asks for you guys to submit your questions. You can ask me on any platform. I generally am pretty good at responding, but don't ask me questions to give you direct advice because you have to be a patient for that. And then I have to do it one-on-one. It cannot be done on social media. So if it's, hey, I've got this problem, what should I do? You have to become a patient. I have to talk to you about it, okay? I hope you guys have a wonderful evening. Wish me luck in Berlin. Everybody, please send lots of messages to my wife not to scream while I drive 250 kilometers an hour or more on the Autobahn.
Scream of an excitement's okay though. Like we.
Oh no, she won't be screaming excitement. No, she'll be screaming that I'm gonna die. Yeah, and I don't mean she's gonna die, that I'm gonna die. Yeah. All right, guys, have a great night. We will see you in 2 weeks on Fertility Fact or Fiction. Have a great night. Take care.